Okay, so here's your range of motion demonstration video. You want to make sure you're knocking on the resident's room before you enter. Identify yourself. Greet the patient. Explain the procedure. Provide for privacy. Make sure your bed rails are in position before you move the patient. After you get them in a good comfy supine position, you can start with range of motion for the elbow. Begin by straightening the arm, making sure you're supporting the arm at the elbow and the wrist, and bend it towards the shoulder on the same side. Closing this angle is called flexion. And when you open the arm, it's called extension. Make sure you're supporting the elbow and the wrist again. Raising the arm straight out in front of them and up towards the sky, towards the head of the bed, is called flexion. As you bring it down to their side, it's considered extension. Make sure you're repeating your movements 5 to 6 times each. Continuing with shoulder range of motion, we have abduction. It's when you take a body part and move it away from the midline. When you move it back towards the midline, it's called adduction. For the last one, bend the resident's elbow and then raise the elbow to the same height as the shoulder. As you move the forearm down towards the body, it's called internal rotation. And as you move it up towards the head, it's called external rotation. If you start by bending the wrist down, that would be called flexion. Bringing it back up to the same level is extension, and then bending the wrist back is hyperextension. Remember, the bones in your forearm are named radial and ulna, and on your pinky side is the ulna, so bending the wrist towards the left is ulnar flexion, and then bending it towards the right is radial flexion. Make sure you cover the resident before you remove any top linen. Support the knee and ankle with your hands and raise the leg towards the body. This is called hip flexion. And as you extend the leg back out straight, it's called hip extension. Just like with the shoulder, move it away from the body for abduction and towards the body for adduction. Last for the hip is rotation. Rotating the leg towards the midline is internal rotation. And then rotating it towards the lateral side is external rotation. Remember to perform each range of motion 5 to 6 times, and repeat the same for the other side. I love you. Blue, 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 blue.